Hi everyone. This discussion I'm going to be talking about our boundaries and boundary crossing for your discussion post. And so I went through all of your discussions and kind of picked out the questions that y'all had, and I kind of just wanted to elaborate on this. So just to be clear about boundary crossing, and we had a question about like when does boundary crossing become a violation. And so when we're being so there's a lot of different boundaries that can be crossed. So just thinking about that, if a boundary is ever crossed and it's like exploitative to the client and it's basically for the therapist's own benefit, then that would be a boundary violation. And so thinking about our moral principles of like beneficence, non-maleficence, like are we being good and are we not causing harm? So if we're causing harm to the client in any way, then that would definitely be a boundary violation. We also, just thinking about it, there's different kinds of boundary crossing. So, like, you know, it could be as simple as going on a walk with a client. Sometimes that will happen. Like if you're at a residential facility, maybe you have some green space, like there's nothing, as long as you can, ensure that you can remain confidential, then there's not really much concern, I would say, with that, especially it helps break the ice sometimes. It could be beneficial for some clients, especially if you consider they're presenting problems, maybe they have agoraphobia, and so that would be beneficial, like walking with a trusted person. Technically that is a boundary crossing, but like, is it being beneficial to the client? And so that also goes into like touching and hugging, like, yes, that would be a boundary cross, but like, is it beneficial to the client? And again, we had another question about that, and I leave it up to the client. But I have, like, for the most part, I have offered a hug for people. You have to know them well, like know what their presenting problem is. If they're not going to read into this, so like thinking about some personality disorders, we have to be careful with our boundary crossing for, say, a client who has borderline personality disorder, because they might latch on to that. And some people argue the slippery slope phenomenon, which isn't really the best argument, because saying that, going for a walk could lead to being friends on Facebook, to being, like seeing each other in person outside of a session. Like, normally it doesn't like snowball like that. And so I don't really see validity in that argument. And it's always something that we can consult about and just think thoroughly through, and basically, is this going to benefit the client? I used to work at a treatment center where we used to eat with our clients because they had eating disorders, and so technically that's not really something that is always therapeutic. Like, it can be, but it's not always, and so that is technically like a boundary cross, but I don't think that's a violation. They need that support sometimes to finish a meal, and so that definitely, just think about it in that way. But always, go through your ethical decision-making model if it's like a big deal. The code of ethics don't really mention anything is off limits, except for, like, if I pull up the code of ethics, looking at the boundaries, the only thing that's prohibited are like sexual and romantic relationships, and having clients from former relationships as well, and from counseling family members and friends, and then engaging in a virtual relationship, so like social media. Those are the only things in the code of ethics that specifically say prohibited. Other things you'll see, they say counselors should consider the risk of, accepting clients of whom they've had a previous relationship, but not, thinking about is a relationship is different from like a friend is a type of relationship. So like if it's like an acquaintance, that's not necessarily off limits, but it should be something considered. Whereas counseling your friend or family is off limits. So look at that, the wording in the code of ethics to kind of help with that too. Someone asked about guns in the background for adults clients if it's virtual. So I think this, really depends. One, it depends on the acuity of the client. Is this client, a potential threat to themselves or others? That's one thing. That's something that should be addressed for sure. And honestly, I don't think high-risk clients are the best fit for virtual, like telehealth. But it happens every day, so that's just me personally. If I have a client who expresses suicidal ideations, I kind of make it a point to try to have our sessions in person as opposed to online. Because you have to think about what would happen if they were just in a crisis and just logged off. Like, what are you going to do? And so, also, it may not be an issue, like if it's just individual therapy and they have guns on the, like in the background, and maybe they hunt or something, maybe recreational use, However, if it's in a group setting, I would say that's not appropriate, and that's something that should be discussed. I wouldn't bring it up like in front of everyone, like address the problem, but maybe, talk to them after, ask them to hang back and kind of discuss that, because it could be triggering to someone else. You just don't know those things. And then the last question on this one, so y'all didn't really have so many questions on this, was about the insecurities of knowing you did enough. And so I would say, as long as you are following the ethics codes as closely as you possibly can, because not everything is black and white like we've talked about. As long as you're going through the ethical decision-making model and those tests of like universality, like would you do the same thing in another case? Would you be okay with this behavior being reported? And would you hope that another counselor in your situation would also follow these same methods? Then I think that you're doing a good job, as long as you're consulting and documenting. So making sure you document, so if anyone were to come back and question your decisions, you documented why you did X, Y, and Z, and so that's clearly thought out and reasonable, then you should be good. I know this boundaries and multiple relationships can be tricky, but I think when considering this topic, what is most important, and I'm not going to say most important, but something that you should think about the most is like your own boundaries, and protecting yourself, because as counselors, as caring individuals, we can give so much of ourselves to other people and our work and our passion. And so just knowing when that's taking also away from you, and you're recognizing when you are experiencing like compassion fatigue or potential signs of burnout or vicarious trauma, and making sure you're attending to yourself and setting boundaries with your work life, I think is so important. And so starting those behaviors now while you're in school and going through this program, I think would really benefit y'all before y'all enter the field. But yeah, so if I didn't answer your questions, or if you have more, or if you just want to talk about this, please reach out to me. I'd happy to talk more. And I hope I answered all your questions. All right, bye.